Welcome to the 211 Community Talk Show. I am your host, Dr. Michelle Vaughn, aka Dr. MV, and I am the Executive Director here at Kishwaukee United Way. So today's show is something different. We are outside. We are at Greater Family Health, which is one of our partnering agencies, and I have the wonderful opportunity to sit down and interview the president, Mr. Bob Tanner, with us today. Mr. Bob, how are you?
I'm doing well, doctor. Thank you for interviewing me.
Yes. Listen, Mr. Tanner, who are you and who is Greater Health Community to DeKalb Sycamore Community? Talk to us about your services because you're doing amazing things with individuals here.
Sure. So Greater Family Health is a community health center. What that means is that we provide primary health care for low-income people. Specifically, we target people whose income is less than double the federal poverty level.
Wow.
The vast majority of our patients are therefore persons that might be publicly insured or uninsured, although we do take most commercial insurances. But like all the community health centers across the country, what we want to do is bring access to primary health care for people that struggle to get access to care. So what we offer is pediatrics, family medicine, internal medicine, obstetrics and gynecology. We offer quite a few behavioral health services, including psychiatry, outpatient therapy, medication-assisted treatment, which is a way we can help people with substance use disorders. And we have two dental clinics. So one closest here is one down in Elgin as well. So our board-certified doctors and nurse practitioners, pediatricians, physician assistants provide care to people that make an appointment. Maybe they'll walk in for care because we do take walk-ins, just like any other doctor's office would be. But we're a little different. One is that we meet the highest quality standards in the country, so we are accredited by the Joint Commission.
Yes.
Secondly, we have a fee scale that slides based on a family's income. And in the end, we will take care of the entire family, regardless of their ability to pay. Thirdly, we're open till 7:30 at night, 4 nights a week, and Fridays and Saturdays from 8 to 5 in order to create access to care for people. And I will also say we're different because I would encourage your viewers to go to our website, greaterfamilyhealth.org. And read the patient satisfaction scores and comments about what our patients think about us, which we publish quarterly on our website. I know what they say, but there's a lot of very, very satisfied patients here. And that should encourage people that may be new to consider us as a medical home option for them.
Wow.
I know that's a lot.
No, it's a lot of good, right? I'm always intrigued when I sit down and have these conversations with individuals because whenever they begin to talk, they talk from a place of passion. And you're passionate about serving individuals. Talk to me about why the healthcare field. How did you land in the healthcare field, serving uninsured, those who are living in poverty? How did you land here?
Well, myself personally, I'm initially trained as a social worker. I have both bachelor's and master's degrees in social work. So I've always been a champion of underserved people. In fact, the first half of my career, I worked with abused and neglected teens in group homes and runaway programs and things of that sort. But Greater Family Health got to be here because our organization was providing primary health care to low-income people. A little bit to the east, Streamwood, Elgin, McHenry, and the leadership of DeKalb County heard of Greater Family Health and invited us to sort of bid to become the community health center for DeKalb County. So we did do that and have been now both in our health center in DeKalb on Annie Glidden, as well as this location here on Plank Road for a decade now.
Wow. That's amazing. So you're definitely needed in the community, and I'm hoping that you do expand. We talked about that. I want to highlight your actual numbers from 2022 in terms of the impact. In 6 counties, you reached and served 67,950 people were served with excellence with the Greater Family Health Agency. Are you growing? Are you seeing numbers that are growing or?
We are growing. And in fact, in calendar year 2023, I'm projecting that we'll grow between 6 and 8%.
Wow.
So we're projecting to, at all 11 of our health centers, including our locations here in DeKalb and Sycamore, we're projecting to have over 71,000 different people receive over 225,000 appointments from our health system, which we're really happy about because that's our mission, to bring access to care for people regardless of their ability to pay. But it really just goes to show you the tremendous need for quality, affordable, accessible pediatric or family medicine or internal medicine or dentistry care for folks. A lot of people are underinsured. A lot of people work at companies where they don't offer insurance, or the deductible for insurance is really, really high. A lot of people struggle to get in to see a doctor because of limited hours, or maybe the doctor has other appointments that they're involved with. So we are certainly able and willing to continue to grow, and we are certainly growing this year for sure.
Right, you definitely are. Prior to the show, you mentioned something about transportation reimbursement to those in need. Can you talk about that?
Yes, we have purposely situated all of our health centers on what public transportation system may be available, but here in DeKalb County, that's not so much. So while the TransVac system does come to our health centers, we do reimburse patients $20 one way for an Uber receipt, Lyft, or other rideshare service, or taxi cab receipt. So it goes to show you the commitment that we have, Greater Family Health has, to helping people that may not have a vehicle. Maybe the vehicle's broken down, they can't get it repaired, whatever the reason may be. We'll reimburse people to come to the doctor's office and get back home to the tune of $40 round trip.
Amazing. We are excited to have you as a partner and agency with Kishwaukee United Way. I love to ask this question to all of our guests on the show. What does Live United mean to Bob?
Well, Live United to Bob means that it really does take multiple families, a neighborhood, a whole cluster of systems to help support, raise children, and support a family. And, again, the social worker in me very much knows that. So I think we can all live better and do better if there was a good degree of mutual respect, trust, and support of each other. The reality is that we're all better off when everybody's doing better. So that's what Live United means to me.
Well, I want to thank you so much for being a part of this show, allowing me to come and be a part of Greater Family Health with the tour. It was wonderful. And we look forward to continuing partnering with you, Bob.
Well, thank you very much, Doctor. Anytime. I'll be happy to meet with you at any time that may be necessary.
Thank you.
Of course. As I'm sure you're aware of what you do for a living, we're open from 8 in the morning till 7:30 at night. We're open on Fridays and Saturdays from 8 till 5. So we have purposely created, and our board has approved, really expansive hours so our patients can get access to care before work or after work or on weekends.